All right, so I have 12 o'clock Eastern right now. So let's go ahead and jump into today's Crisis Jam. Many of you may know I'm Lindsey Browning. I'm Director of Medicaid Programming at the National Association of Medicaid Directors, and really delighted to return as your host for today's conversation. So if you want to go ahead and move forward, just a couple of quick housekeeping notes. If you all change your view to side-by-side speaker, that's probably the best way to view our conversation today. And also ask folks to turn off your camera when you're not speaking, just to preserve bandwidth and make it a little easier for folks to see the interpreter. All right, so let's move forward. So we've got a lot of folks who join these calls. We're really thrilled to continue to see this community grow. In particular, I think we broke our record for attendees a couple weeks back. And sorry, Karen, if you want to go ahead and move to the slide with the map. Medicaid leaders who are on the call, if your state is not reflected in blue on the map, please reach out to the team here and they'll get that reflected. We want to show our Medicaid representation loud and proud as part of this group. So please do that. Next slide. Just as another reminder, we've got all the resources and information for these conversations on the Crisis Now website. In particular, we know a lot of folks are going here to watch the featured presentations each week, but you can find it chock full of resources and materials. So please make sure you go there and tell your friends about the website. Next slide. Go ahead and keep moving to the next one. So we also wanted to flag that there's been increasing press coverage of some of the healthcare industry's reaction to the report on parity. So folks may want to check out this recent Politico article that just looks at some of the dynamics happening in Washington around the increased focus on parity. Next slide. We also wanted to, for the quote for today, you can go ahead and move to that one, Karen. The quote for today comes from Dr. John Franklin Sierra, who is in fact our featured presentation. And as you all know, he's a systems engineer. And one of the things he has told us is that, you know, when you think about systems, the full scope is overwhelming. So it's really important to help others see the baby steps. And I think that's just a phenomenal quote to lead us into our conversation today and our featured presentation. So you can go ahead and move to the next slide. So I am thrilled to introduce Dr. John Franklin Sierra. And as I understand it, Dr. Sierra, this is your third time joining us here, which is a record for the Crisis Jam, and I think earned you some special accolades. But really delighted to have you joining us. And as most of you know, John is with the Los Angeles County Department of Mental Health, and as his bio says, a generally useful person, which I think we all aspire to. So, Dr. Sierra, I'll turn it to you to lead us off in this presentation about systems engineering and what that can, how that can help us as we think about 988 and crisis services.
Good thing. Thanks, Lindsay. Can you all hear me?
Yep.
All right. Go to the next slide here. So as Lindsay mentioned, my name is John Franklin Sierra. I'm an industrial and systems engineer by training, studied that at USC with a focus on health systems. Just briefly, ISEs, they apply analytics and critical decision-making skills to optimize complex processes, systems, networks, and organizations. I found that, I think that's a great just summary of what ISEs are all about. I graduated in 2017, went to work for the LA County Department of Mental Health, and now just recently transitioned to the county's chief executive office, although I'm continuing to work on similar issues, including the county's Alternative Crisis Response Initiative, or ACR, which is actually what led me to be joining you all for the third time now, as LA County's focused on improving our crisis systems. And so I just have this one quote I wanted to share from Reza Aslan, who's a religious scholar, that if you want to find water, you don't dig 6 1-foot wells, you dig 1 6-foot well. For me, systems thinking and systems engineering has really been my 6-foot well. So I'm excited to share a little bit about it with you all today. Next slide. So what is systems engineering? It starts with systems thinking, and there's a lot involved in systems thinking. It's a very big field, but if I had to sum it up in one sentence, that one you may have heard from others before, it's that every system is perfectly designed to get the results it gets. What this really means is that, the structure of systems is what produces the behavior you see out of them. Even if that behavior can be kind of confusing or just, seemingly random or variable, it's still governed by this design and the structure of the system itself. That is, the behavior you see out of a system is either allowed by it or even encouraged by its design. And so systems engineering takes that a step further and basically says, okay, knowing that, let's try to make the system perfectly designed to get the results that we actually want. Systems engineering is an attempt to intelligently redesign systems and change their structure to reliably produce, different, more desired behavior, including different kinds of variation. You can't obviously always in variable systems produce, the exact same outcome all the time, but you can often move the mean in a normal distribution of outcomes, and otherwise provide, just different kinds of variable results. So systems thinking is really a prerequisite to this system engineering, right? You need to know how to define the structure of a system and understand how that structure produces its system's behavior, in order to really know how to change that structure to produce different outcomes. Let's go to the next slide. So there are all kinds of systems, but I think in systems engineering, the ones we're most focused on are human systems. And so, system structure, delving into that a little bit more, really comes from the interrelationships between the different parts of a system that over time influence the resulting behavior, not dissimilar from how, your mind and your consciousness arises from the interrelationships of billions and billions of neurons, right? Systems are kind of similar in that way. So some examples. Systems often have information that initiates feedback loops leading to particular types of reactions. Taking it even a further, more abstract, there are rules, norms, protocols within systems which can establish regular patterns of how certain information results in certain reactions, right? And then even a layer of abstraction above that, you can talk about the paradigms of thought or mental models which led to the rules or norms or protocols in the first place, right? So, in human systems, you can kind of see from this that we are inextricably a part of this structure, right? And so changing human systems really often starts with changing ourselves and how we think, or help ideally trying to encourage others to change how they think as well. We can influence the quality and accuracy of the information that drives reactions. We can change the rules for how that leads to certain decisions, right? And with a lot of time and attention, we can change our rule forming mental models too. So wanted to lead with that and go to the next slide. Like all true engineers, we have a big toolbox of things that we use. And I think oftentimes engineers get associated with their tools. And I understand why. I think tools are sometimes the most famous part about engineers, but at the end of the day, just like knowing how to be a good carpenter doesn't necessarily make you know how to build a house. The tools are important, but they are in and of itself just like means to an end to achieve system change. So here's a non-exhaustive list of some of the tools that systems engineers commonly use. These are actually even just categories of tools. There's many different tools in these categories. Some are qualitative, some are quantitative. I think that these are all really amazing tools that I've used, throughout my career. I wanted to focus on one particular category of tools, though, this system and process mapping, though, because I think that this is a really powerful set of tools for systems change that really anybody can learn to use. And I'm going to show you an example of one. Go on to the next slide here. So this tool is an example of something called a causal loop diagram. It's an example of a system mapping tool that in a way can help you piece together and understand the structure of a system a little bit better. So causal loop diagrams kind of start with this premise that in most human systems, there are often not just straight linear pathways of causality. You often see circles of causality. And so here's an example using some, I think, of what we're aspiring to in this crisis services space, right? So, we want more investment in crisis care because we think that'll lead to better access to crisis care and hopefully utilization of crisis care, right? And then, well, better access to crisis care and utilization ought to lead to more positive outcomes, whether it's reduced reliance on law enforcement for responding to folks in crisis, or reduced expenditures on hospital or emergency room care, just improved, outcomes for those individuals who are in crisis and being served by crisis care, right? Well, and then those positive outcomes ought to reverberate and, hopefully lead to more investment in crisis care, right? So this is an example of aspirationally something we're hoping to see in our system. And it's also a particular example of what's called a reinforcing feedback loop. You can see everything is positive. So it basically, as one increases, the next increases, the next increases, and on and on and on. It's a reinforcing, or what's called a positive feedback loop in systems thinking. And that's it, right? We're done here. Our job is done. This is all we have to accomplish, right? Of course not. It's not that easy, right? If you go to the next slide, what you often see in systems where you're trying to grow something or improve something is you encounter limits. So here's an example that you all have talked about before, and I'm sure are dealing with in one aspect or another in your organizations all the time. And so you have limits related to workforce, right? As you strive to improve access to crisis care, that increases your workforce needs. And well, those higher workforce needs diminish the available workforce to do this kind of services, right? And that available workforce is a limiting factor on how much you can increase your crisis care. So this is actually an example on the right of a balancing feedback loop, or what's called sometimes a negative feedback loop, where an increase in one thing leads to a decrease in another and comes back to result in kind of establishing a sort of homeostasis or a balancing toward a mean in a system. This pairing actually of a reinforcing feedback loop on one side and a balancing feedback loop on the other is a classic systems archetype called a limits to growth archetype, where you have some kind of reinforcing loop trying to grow something in a system coming up against some kind of limits, which are plateauing that growth in some way, right? And you see these actually throughout systems and all kinds of different systems. The classic is ecological systems, right? Where you may have a population of animals that's growing and coming up against some kind of, limiting factor, whether it's resources or predators or something like that, right? So what do we do about this? Go to the next slide. The answer, as you might guess, is not push harder and invest more in crisis care, right? Because you're going to keep running up against this limit no matter what. The answer to improving growth in this system is to address the limits themselves. The answer lies in looking at those balancing feedback loops and then the factors driving that balance and adjusting from there. So, you all have been looking at using more peers and paraprofessionals in the workforce for crisis care, improving training and incentive programs to hire and retain staff, right? Those are things that can be done to directly increase the available workforce. And get around this limit in some way, right? The lesson being when these limits to growth archetypes and systems, right? When growth slows, you don't push harder, right? You address the limiting factors instead. Now, this is just one, I think, very familiar example of limiting factors to you all here in our attempt to grow crisis care throughout the country. There are others. I'm sure you encounter those others all the time. And those could also be diagrammed as, as a different set of factors limiting growth on the right side. I think that's something to think about, is like, what are those factors really limiting the growth of crisis care that we need to very intentionally address, including, addressing the rules and policies and mental models that might be driving those limits. And there's an example already here, right? The use of peers until, not that long ago, was not seen as a viable way to increase the workforce. There was a shift of mindset, right, that led to that, the experimentation of using more peers and paraprofessionals in this space. And that shift of mindset is what actually increased the available workforce. The population rate of individuals didn't just take off or anything like that, right? It was a different mindset that led to an actual increase in the workforce available to do these services. And you'll see that a lot in all kinds of systems engineering problems. Next slide. So just like summing up the points you saw earlier for this set of slides, a few key takeaways, right? The system isn't broken. It's operating exactly as is designed. The structure of systems are what produces its behavior, right? And so if we want to change that behavior, we need to change the structure. Furthermore, for human systems, we're all a part of that structure. And so I encourage you to look for yourself and your organization in the structure you're trying to change and see how those things, how you can change those things and change the structure of the systems you're working with. Start with qualitative tools like system diagrams and maps when you're trying to diagram out systems and think through the system problems, and then use data to give them grounding. And then leverage points for systems change aren't always obvious. Finding them, though, can be really clarifying and empowering. And looking at archetypes in systems like the limits to growth one I showed you gives an example of where you need to look for leverage points, often on the balancing side and the limiting factors in systems, first and foremost. And then lastly, in the shadow between the idea and the reality of systems change, just, again, be patient, open-minded, and self-reflective, but also relentless and illuminating. And I think you can accomplish really great things. So the last slide is just some examples of further inquiry that you can follow up on. If you go to that slide, there's these two books here in particular I really love and I think pair really well together. And then I've given you an example of some tools you can explore using as well, all of which have free to use versions for making systems maps. Those systems maps I showed you, actually, I made with that first tool, Loopy, right there. And that's it.
That's really incredible. Thank you, John, for that practical and grounded perspective on systems design. Amy, I want to turn it to you as we move into our roundtable, and then I want to get to some of the questions in the chat. So reflections from you on what John just shared.
Thanks, Lindsay. John, we haven't actually ever met, but we're neighbors. I used to work at the GLA VA, and I think you did an internship or something there, and I'm here in Los Angeles. John, Sharon, and I had kitty corner offices at the VA. So I've been following your work for a number of years, have been very impressed with what LADMH and partnering with other places around the city like D.D. Hirsch have done. So I've been really impressed. I'm also one of those people who's a big fan of systems engineers. I have hit my head against the wall many times where I've built something and nobody came. And I learned early on, I got to figure out what the system needs before I build something. And I think you're really right with, one of my favorite tools is process mapping. And although it feels daunting at the beginning, the process itself of making the process map is really, really informative, because you have to get a lot of people to the table to make a really good one and to find where the holes are. So I really, I love the fact that you showed some process mapping. And I think that's really important. And I think it provides hope to many of us in the audience, because if you can do a process map of LA County's system, you're probably, none of us can make an excuse that we can't make one, because that's a really, really big system. One of the things that I was looking at some of your old writings and talks, and this idea of trust, I thought was really, really important, because you can't have, none of our crisis systems are in a vacuum, right? We all relate to something else in the process map. There's all these different groups together, and it doesn't work if there's not mutual trust between all of them. No one can be rowing in a different direction, because it throws the whole system off. And so I thought, you're in your previous writings and previous talks here on the Jam about this idea of building trust between the different parts on your process map is really, really important. And I was just kind of reflecting on that this morning as I was thinking about you coming on. The last thing I'll say that I have learned from some of the things I've been following from you is this idea that the beginning and the end of the process map that you initially think of might not be the true beginning and end, right? So we have to look at what came before sort of intercept zero and what comes after the end of it, right? So it's not so like what I've learned from you is to think bigger, make your first process map, but then revisit it, think about it again, and what comes in both ends and where do you leave them at the end. So again, just a lot of kudos and respect to you personally and those who do the kind of work that you do, because again, we want to build back better. And we want to use some of the tools that you're talking about and the expertise of someone like yourself to make sure that our crisis system that we're spending so much time and energy on actually is going to work for our audience. So thank you again for joining us today on the Jam. Thanks, Lindsey.
Yeah, and Amy, I would just reflect, your point around building trust between players in the system really resonates with me. Being in the Medicaid world, we touch and interact with so many other systems, and sometimes you sort of throw up your hands because of the complexity of it, but really we have to focus on those points of intersectionality and build that trust to make it work cohesively together. So I know we got a couple of questions in the chat. One question that came up was around value stream mapping. And the question is, value stream mapping that focuses on waste in the system could be particularly helpful here. John, have you considered that for the behavioral health system?
Sure, absolutely. No, value stream mapping is a good example of a type of process map that's often used in industrial engineering too, as well as systems engineering. I think there's, sometimes there's different maps that are helpful for different layers of abstraction. Value stream mapping, I think, can especially be helpful, in my opinion, at least at some of the more micro layers where you're dealing with like one particular organization or some particular business processes within that organization. Value stream mapping is used a lot in Lean Six Sigma quality improvement type efforts in organizations, right, to essentially reduce different kinds of waste along the way in a process from its inputs to its outputs. So that's a great example of a type of system or process map that can be really valuable. And there's others that, like the causal loop diagrams I showed you, is a good example of a more macro tool for kind of understanding systems at a higher level of abstraction. Both are really valuable to use in tandem with one another.
Great. Mark, I saw Mark from NAMI in Washington. I saw you had a question about tacit knowledge. Can I ask you to jump in and ask your question just to make sure we understand what you're looking for?
Oh, hi. Thank you. I didn't expect that. What we know about systems is sometimes really hard to know because the knowledge is not explicit. That is, it's tacit and held by people through experiential knowledge, and so I think that's, in a way, that's a barrier to a systems diagram, isn't it?
Yes and no. I mean, so you're absolutely right that, I mean, the nature of systems thinking and systems problems is that, some of the best tools we've had for describing problems historically, like words and graphs and that kind of thing, are just more linear in nature, right? And they're not necessarily the most adept tools for explaining system problems. Especially where you have really like layered interactions of causality that stretch across a system, right? You can make causal loop diagrams that expand quite a bit, where you can kind of see how changes on one end kind of reverberate and all the way get to changes on the other end. And so that's why systems thinkers and engineers have designed tools like that to help in communicating system problems a little bit better and explaining and making some of that tacit knowledge more explicit in, how a system is designed. It's difficult. It is very difficult, as you said. Try looking at a blank piece of paper and try drawing a system diagram. It's intimidating, right? But the exercise itself can be so illuminating, and I think so valuable to your developing your own understanding of the system you're working with and your place within that system, right? And I think is a really amazing brainstorming exercise that can lead to real insights. And if you create a good map, you can share it with others and help make that tacit knowledge a little more explicit.
John, one more question before we move on. Someone asked in the chat, if you're doing the system mapping and you identify constraints that seem to be intractable, or maybe they're things that are outside of your control, things like racism or economic inequalities, et cetera. How do you approach that or handle that in system mapping? It seems like that could be a point of real frustration of this exercise.
It could, intractable obviously depends on the vantage point of the person and the kind of leverage they feel that they have. But at some point, all of us will run across limits that truly are intractable. I mean, ecological systems are a great example. Like, they all exist within a finite universe that eventually there's nothing that you can do to get around it. So I think that, I always encourage, at least some thinking and brainstorming around, is this limit truly intractable? Is there truly nothing we can do about it, right? And after you've done that, if you think, okay, yes, for right now, there's nothing I can do about it, then those kind of limits can actually be really clarifying, I think. Those are the kinds of limits that actually engineers love. And in fact, in engineering terms, we call them constraints. Because they help to focus our design thinking in particular areas, and they bound the scope of the world in which we have to design in a way that actually makes solving problems easier. And so I think that I again always encourage you to look at, are these truly intractable limits? But if they are, try to run with those and use those to harness and focus your design thinking and for change, rather than seeing them as some kind of insurmountable barriers.
Really helpful. And I think we have time for one more. And the other question that came up earlier was around asking you for a little bit of clarification between the connection between systems engineering and design thinking. Sort of, how do you see those two concepts fitting together?
Well, I mean, they're synonymous, really. I mean, engineering at the end of the day is technical design. That's what engineering is, right? It's and then we give added names to it, right? Like civil engineers they design buildings and bridges, and electrical engineers design optics and circuits, and systems engineers design systems. It's engineering is design, and it's designed with a set of particular tools that go along with it, both quantitative and qualitative tools, but it's design. It really is. And so I think that design thinking is a critical part of being a good engineer.
Well, John, thank you so much for sharing yet another nugget of wisdom with us and joining us for your third Crisis Now feature presentation. Everybody should go to the Crisis Now website if you want the slides. Those will be available up there, and some, again, really good nuggets of wisdom for the work that we're all doing on a daily basis, and to think about the systems design of it. And if we're designing things the way we want them to what we want them to achieve. So John, thank you so much. So let's go ahead and move forward into our trivia question of the day. And I am excited that I get to put Tom Betlach on the spot for this. Many of you may know that Tom is a former Medicaid director and former budget director in Arizona, and someone that I've worked closely with over the years at NAMD. So Tom, here's your question. So the question around poison control centers. So poison control centers expanded rapidly in the 1950s, despite consistent funding or formal structure. By the 1970s, the rise of emergency medicine drove that number to 660 centers. So we'll pull up a poll and you can get some feedback from the audience, but here are your choices. So we're looking at 21, 55, 307, or 1,324 centers today.
So how long do I get to wait for the audience responses to help inform my decision, Lindsay?
We'll give the audience 10, 15 seconds or so. So
okay.
Folks have to be pretty quick on the draw here.
I was going to go with homeostasis. I thought that was the best word John used in his presentation. So that was going to be my answer to whatever the question was. Homeostasis.
So Karen, can we see what our crew thinks is the answer? Ooh, a little all over the place, Tom.
So there's one in Arizona. I'm guessing probably what we're talking about is not trying to get too much duplication and seeing the efforts get consolidated so that people would know where to go to as it relates to poison control center. And I'll spare all the audience our own family experience where my wife got stung by a scorpion and engaged with poison control center, but I'm going to say 55.
All right, Karen, can we move the slide forward? Show the answer. Tom, I'm really impressed. When we were doing the green room before this meeting, I thought it was about the same, you know, about 307, like a small contraction, but not a lot. But you're spot on. We've seen, you know, more of a consolidation into a fewer number of centers. We have some specialty across the country, but definitely not that 660 number that we were looking at before. So congrats.
Thank you very much. Always difficult to be in the seat. You never know what the question is, and it's never easy, but I guessed lucky today. So thanks, Lindsay.
Yeah, and I think a preview of what's to come in upcoming programming, there's going to be some presentation on what we can learn from poison control centers to apply to the crisis work we're doing, the 988 work. So some really interesting parallels there.
Well, and I think, again, our own family experience made it easier in Arizona. There was only one number. We knew who we needed to talk to, and the experience went well. So we can share our own lived experience with that. So thanks, Lindsay. Good to see you again.
All right. So I'm pleased to hand it over to Stephanie Hepburn for this week's crisis talk. So Stephanie, I'll let you take it away.
Thanks, Lindsay. Yeah, so this week I spoke with Steve Hammerdinger. He's the Office of Deaf Services Director at the Alabama Department of Mental Health. He shared that only a handful of states can address the deaf community, and most depend on ad hoc arrangements. Steve, if you're on the line, we discussed the crisis continuum and how each element, the 988 call center, mobile crisis, and crisis stabilization, needs to be able to address the deaf community. Can you talk a little bit about that?
This is the interpreter. One moment. Jen, can you see him? Just wait and copy. I'm asking the other interpreter right now. He's freezing up my screen, but it's also raining, so I don't know if it's my Wi-Fi or that.
Okay.
Jen, can you see?
Yes, very clearly. Mm-hmm. All right, I want to make sure we're good to go. Okay, I'll go ahead. Yes, thank you so much for inviting me here today. I really appreciate it. It's always a pleasure. So go ahead. Did you have some questions you wanted to ask?
Yeah, so we were talking about, in our interview, you talked about the crisis continuum and how each element, like the 988 call center, mobile crisis, and crisis stabilization, needs to be able to address the deaf community. Can you talk a little bit about that?
Yes, well, there is one big concern with the deaf community and the support that the deaf community has throughout the mental health system. We try to make a page where we can keep all of our tools. We try to keep them all in one place. People tend to view deaf as broken. You know, they just can't hear. But what they don't consider is that we have linguistic differences, and we're actually real people. We just experience the world differently from a linguistic perspective. Secondly, people typically don't consider that where you have a large group of English speakers, every once in a while, you do need to make plans for addressing the situation when you have someone come in who is not an English speaker, and that can include a deaf person. So our work here is what we try to do is we try to make recommendations. We draft recommendations as far as the differences in the 988 system and how we can address that and approach these issues when they do come up. And it is frequent that the deaf people are utilizing these services. The 988 system is popping up all over the nation, and we need to develop our skills in addressing the signing community, the deaf community. We also work on developing positions, and that we will be ready soon, as to how we can best make changes that will be valuable for the deaf community. We'd also like to have a center where they all sign, where people can have their therapy in sign language, and that would be available 24/7 for our community.
When we talked, you mentioned why incorporating an interpreter, especially one who isn't trained in behavioral health, is problematic. Can you talk a little bit about that as well?
Yes, absolutely. There's different layers of problems that we need to approach with this. There are technical issues that come up in regards to between the interpreter and the provider. You have three different prongs to that stool. So communication breakdown can happen because it's not direct between the therapist and the consumer. Now you're going through a third party, and that can become very frustrating. Secondly, with interpreters, some interpreters are fantastic. They've had very good training. They have a lot of experience working in the mental health arena. And that's great. And I congratulate them. That's fantastic. But oftentimes, providers are reliant on the interpreters who have no background in mental health interpreting. But the providers don't realize that. They think interpreter is an interpreter. They're all the same. And that is not true. So a lot of them also rely on VRS, which is a video relay service. They do ad hoc preparations, meaning they don't have any idea who the interpreter is prior to the appointment. And, again, I'd like to emphasize to the audience here today, you're not hearing me, you're actually hearing what the interpreter thinks I'm saying. And that interpreter, maybe it's very close to what I'm saying, and maybe it's completely wrong. Maybe it's completely off the point from what I'm saying. And I did a national presentation a few years back in Baltimore, Maryland. And I was amazed at how different the interpreter was from what I actually said. Now, the audience was a mix of people who were hearing and people who were deaf and signing people. Now, the deaf portion of the audience completely got my presentation because they weren't relying on the interpreter. The hearing audience in my presentation got a completely different message because they were going through the interpreter. So the providers really, need to know who their interpreter is. And they have to understand they're hearing the interpreter. They're not necessarily hearing their consumer. And then when you add emotions into the mix, it's a real challenge. And it scares me to think about, providers just putting any interpreter into that situation, not knowing the interpreter's skills and the possible repercussions of that.
Thank you so much for coming on the call and talking with us.
It's my pleasure. Thank you so much for asking me to join. I appreciate it so much. I love the article, and you all are doing a fantastic job. Thank you so much.
And I want to echo that thanks. And I really want to appreciate and recognize Megan at Nashville for bringing the importance of the deaf and hard of hearing community to this work around 988. I think these are really insightful and important considerations as we think about and ensure that 988 is responsive to the needs of everybody who will be using it and accessing it. So let's go ahead and move on to our next piece here, which is we want to hear from John with the updates from SAMHSA. So John.
Thanks, Lindsay, and thanks to the presenters. Really appreciate the dedicated section on access. I think that's really a critical piece, obviously, as we're thinking about 988 across a number of different populations. So just a couple of quick updates, and then I'll pass it off to Richard McKeon, who's on the call as well. Just wanted to let everyone know that we are finalizing our date for the convening, part 2 of the convening, focused on 988 readiness across some key audiences. I apologize for the lag in that date, which we were hoping to kind of have finalized last week, but it just didn't work out that way for various reasons. But really planning to settle in on a date this week, which we will obviously disseminate to the group and beyond. Also wanted to flag that we are, in addition, planning some listening sessions with tribal leaders next week on March 3rd. In addition to those listening sessions, really planning for a bit of a deeper exploration with tribal leaders in a more of a formal consultation process. So really, this is just kind of what we're doing next week, kind of built upon some other listening sessions that we've had with tribal leaders, and really kind of using that to sort of build up to a more formal consultation process. While tribal nations have been factored into some of the broader 988 readiness work that we've been doing, we really do recognize that there are some unique needs and challenges of tribal nations with respect to 988 implementation that really require both an inclusive consideration in the broader 988, but also some dedicated time to really focus more specifically on the unique needs of tribal nations. And so really planning to build that out over the coming weeks. Also just wanted to flag that there is a lot of work going on behind the scenes and also upfront with respect to communications. I know communications and messaging is probably in sort of the top 3 of questions that I and other folks in SAMHSA get. And so we do have a small but mighty communications team doing a lot of work, developing a partner toolkit, building out our website, obviously participating in the messaging task force with the Action Alliance and Vibrant, which the webinar for that will be coming out in March, as we talked about last week. And our communications lead, Kate Galatis, will also come onto this crisis jam, I think in 3 weeks, to provide more detail on the communications planning that's been going on within SAMHSA. And I know that that's an area of interest for many folks on the call. And then finally, just also wanted to let the group know that we also have been engaged in sort of a workforce discovery sprint, again, really recognizing the major challenges around workforce. This came up earlier in this meeting just now, and it comes up really in just about every discussion we have around 988 implementation, and thinking about creative out-of-the-box solutions, really doing a lot of meeting with partners both across the federal government and outside of the federal government to sort of look at models for surge processes and ways to scale up and accelerate workforce quickly, and perhaps other models that have been used that we can learn from as we're approaching what we all are expecting to be a significant challenge this year. And then I'm going to hand it off to Richard. Richard, do you have any other updates?
Yeah, so James Wright is on vacation, a much needed vacation this week. So if he were here, I'm sure that what he would say is that the currently, the $282 million that was that we're all very grateful was made available to support 988. That all of the applications for that are in, including the $105 million to states, as well as the dollars that went to Vibrant for backup centers, chat tech centers, and Spanish language centers. And so, the review processes for both of those are ongoing. And we'll look forward to the announcements, for those in the weeks ahead. The only other thing I would just mention is, we've been tracking closely on the issue of 988, 911 coordination. And we keep on finding interesting pieces of work that are going on in that area. On Friday, actually, there will be a webinar that Dee Hirsch is doing regarding their 988, 911 program, diverting from the LAPD's communication center to Dee Hirsch. Last year, there were about 13 to 1,400 times when police would have been sent, but were not because of that program, and they were disproportionately people of color. So it's a very intriguing. Also, just recently learned that Washington, D.C. has initiated a similar program. And whenever I hear about a program like this, I ask about how it's being funded so we can understand it better. And in Washington, D.C., they're using American Rescue Plan dollars, which is great, but not obviously an ongoing source of funding. So those are some of the questions that we're asking about as we continue to look at how to make the coordination between 988 and 911 be as effective as possible. So that's what I have, John.
Thank you, Richard. Thanks, Lindsay.
Great. Thank you both so much. All right, let's go ahead and move on to our Nashville update. So Brian, I'll turn it to you.
Thank you, Lindsay, and wanted to thank John and Richard for their ongoing work and support as we move towards 988 readiness. Also, to thank SAMHSA for their leadership in pushing forward with the child and adolescent national guidelines for crisis care, and hopefully that will be out soon, and we look forward to the results of that. Before I go on, though, I did want to ask Megan to come on for a minute and talk about something that's so important to her, and that's deaf services. Megan.
Thank you so much, Brian. And the reason it is so important to me is because as you read the Crisis Talk article this week, deaf people, deaf services are often an afterthought. And I feel strongly that this shouldn't be an afterthought, and that the deaf community should be folded into 988 planning. Right now, Nashville is working with the deaf community on recommendations for 988 implementation. And one of the central recommendations is to have a centralized location call center for people who are deaf and hard of hearing that have direct ASL fluent counselors. And that is so important for the reasons that Steve Hammerdinger talked about previously. An interpreter doesn't, when you're in crisis, you don't want somebody interpreting your feelings. You want direct communication. The deaf community has a very specific culture. There are unique traumas to the deaf community. And somebody who is an ASL fluent counselor and is trained in crisis counseling can really understand a lot of that, and it builds trust. I think that's very, very important in the deaf community, considering what's happened historically for them in behavioral health. So I just wanted to put those points on. Thank you very much, Brian.
Thank you, Megan. And let me bring in Aaron Walker to talk about the Model 988 legislation. Aaron?
Thank you, Brian. As you were promised last week by Arlene Stevenson of Nashville, if you look in the chat, you'll see a link to the updated 988 model legislation. This again was a group effort. This actually originated, the updates originated out of the 988 state legislation work group. I want to thank everyone for all their efforts and suggestions. Again, this is a template to help states with their 988 fees. Definitely, if you have any questions, feel free to reach out. And thank you so much again for all of your partnership. And Brian, I'll pass it back to you.
Thank you, Aaron. And next slide, please. So just real quickly, I wanted to highlight the 2021 Ready to Respond Mental Health Beyond Crisis and COVID-19. If you click on that, there's a really nice paper on technology that was done by Stephen Filippi, and hopefully you'll have time to take a look at that. With that, I'm finished. Thank you.
Great, thank you so much. All right, let's turn to the federal update. And Sarah, I think I'll turn to you first, and then Johanna. Oh, I'm sorry. I'm
Yeah.
sorry. Before we go there, we missed the slide earlier, and so I wanted to hit on this real quick too. So Mental Health America just released this dashboard that looks at mental health risk assessments. And I think it's a great resource for everybody to be aware of because it can help provide some insight on the potential demand for 988. So Mary, I don't know if you wanted to say a word or two about this, and I think we'll have you on at a future date to go in more detail.
Thank you so much, Lindsay. Yes, this was just released. It's by state and county. So you can even look within states to see where we got more people screening positive for depression, for suicide, and for several other conditions. So we hope folks will take a look at this and use it as they do their planning around 988. And in our office who did this work will be happy to come on at a later date and give you all more details on how it can be used. But it is a new resource and we're really thrilled to make people aware of it and hope everybody uses it.
Thanks, Mary. And I'm going to go dig in after this call. It looks really, really useful. So appreciate all the work on that. Okay, now let's shift gears to our federal update. Sarah, I'll go to you first.
Great. Thank you, Lindsay. And if we can go to the next slide, I have a very quick update on the FY22 appropriations middle portion of the graphic here. We are on another continuing resolution, this time a 3-week stopgap that goes to March 11th, and that was signed into law on Friday, right before the previous CR deadline. It looks like they are coming pretty close to finding final agreement and putting together the rest of the FY22 appropriations into a larger omnibus package. But we do not have official text or agreement that has been made publicly available as of yet. So hopefully we'll have more news on that by next week. And then a quick update, next week we should have Dr. Eric Rafla Yuan from Congressman Cardenas's office to give a few words leading into the introduction of that 988 implementation bill that Eric presented on, I believe, back in January on the crisis jam. So that seems to be coming together quickly, and hopefully next week he can preview introduction that is currently planned for the end of next week. That's it for me. Joanna, I think you're next.
Yes, so it was just announced today that the House Ways and Means committee is going to be having a hearing on substance use suicide risk in the American healthcare system, and that's coming up on March 2nd at 10 a.m. So just wanted to let everyone know that, make sure everyone's aware.
Fantastic. Thank you guys for those updates. All right, let's move forward to our state updates. And Stephanie and Laura, I'll turn it to you guys.
Great, thanks, Lindsay. This is Laura Evans from Vibrant. I also just want to echo some thanks to SAMHSA for the funding opportunities that have been made available to help prepare for this transition. And also thank you to the entire NASHBID team, both for the model legislation that many states are using to inform their 988 policies, as well as highlighting the need to be inclusive with the Lifeline services, particularly for the deaf and hard of hearing community, which we are working very closely with, as well as other communities that are at high risk and have been historically marginalized. There have been some updates. We have not tracked any new introductions related to 988, but just some updates on some hearings that have occurred in the last week or so. We mentioned the Hawaii legislation. That bill was amended in committee last week. It was changed to have an effective date of 2060. So that bill is likely dead and not moving forward. However, there's another bill in that state as well, Senate Bill 2265, which was passed out of committee unamended after amendments in the first committee and can next be heard on the chamber floor in Hawaii. And so that legislation would require the development of a 988 plan. There is no fee mechanism included in that legislation. If we move to Kansas, their legislation, House Bill 2281, was substituted in committee and now moves to the Energy and Public Utilities Committee for consideration. We have not seen what that substitute language looks like, but we believe that that fee mechanism is still included in that legislation. Also last week, we had talked about a hearing in Illinois. That bill did pass out of committee and can move through the process. So that is where we are in terms of state updates. Steph, did I miss anything? And happy for any organization to hop on board and explain more.
No, Laura, you did a great job. Just quickly adding Illinois to the list. Senate Bill 2945. This bill creates the 988 Trust Fund. Just mentioning that that bill passed the state Senate last week.
Great. Thank you guys for those updates. Clearly lots of activity happening as states go into legislative session and get in full swing there. We can go ahead and move to the next slide. Just wanted to flag again that these state cards are up on the website and encourage you all to check them out. They provide a nice look at the actions some states are taking around 988 to prepare and some of the funding. So we got Virginia and a couple of other states up on the website, Utah, Washington, and Nevada. So please check those out. I also wanted to give a plug for the National Survey of Mobile Crisis Teams. I already saw this kind of go back and forth in the chat, but the deadline to respond is on Monday. And Matthew, do you want to just jump in and give a quick plug?
Yeah, sure. Thank you so much. Good to see everybody. So this survey, it's been really successful already. We've got 250 responses. There are still some states that we have not yet gotten responses from. So our partners at Nashville are generously reaching out to certain state leaders to try to track down as many responses as possible and encourage you all to continue to disseminate this in this final stretch of data collection. So the link is in the chat and here on the slides, and really encourage everybody to respond so we can get as complete a sample as possible. Thanks so much.
Great, thank you, Matthew. And I saw a question in the chat about those state cards that I just had up before this. Those are on the Crisis Now website. And yeah, I see Karen's put a link in the chat to those. So we can go ahead and move to the next slide. Let's see. You again want to remind folks about some tools that are available, and I'll just turn it to Paul to give a couple quick updates.
So I know we did a little bit last week, Lindsay. All I would say is I can't wait for the world to see the fantastic work McKinsey and Company and their Center for Societal Benefit have done. It really is an advanced tool. We had a model out there, which John Franklin Sierra continuously reminds me, every model is wrong, but some are useful. And I think it's been useful so far. The data has been pressure tested with multiple states. You'll see some revisions, and we expect to get a view of it next month, and hopefully it'll be available to all of you in March. So really anxious to see that come out.
Fantastic. I'm looking forward to that as well. I think it'll be really useful for this community. On the next slide, we just want to again quickly remind folks to check out Moving America's Soul on Suicide in episode 3 that is now out. So the URL is there in the upper left-hand corner. And then finally, want to hit on kind of what to expect next, what's next on tap for this group. And in particular, I want to call folks' attention to the fact that in a couple of weeks, we're going to be discussing and hearing from SAMHSA on their communication toolkit that I know everybody's been eagerly waiting for. But on March 9th, we're also going to have a conversation and hear from Dr. Henry Harbin around standardized billing for crisis, which I know is a hot topic for folks as well, and an important piece of the overall picture and work that we're doing. So with that, I think that's the full deck, and I am delighted to say that we wrapped up in under the hour and give you guys back at least 60 seconds of your time. So thank you all so much for joining for the conversation today, and we look forward to seeing you all next week. Take care.